Hi, I'm Dr. Sam Lamb, Rhinoplasty surgeon in Plano, Texas, just north of Dallas, Texas. I talk about very complicated topics in terms of nasal anatomy to my patients on a daily basis, and it's incredibly hard to articulate. So one of the ones I've been doing over the last couple of years is called the lateral turn-in flap, and it's one of the biggest, coolest things that I do out of the million things that I do. And I wanted to sort of explain it to you. I'll be honest with you, when I started doing rhinoplasty in the mid-90s, I really didn't even know the anatomy. It was really hard to understand anatomy, and it took a while to really get to understand what the nose is all about. Danielle, who's done a lot of rhinoplasties with me, who's filming this procedure for me as my assistant, only scratching the surface of understanding what a nose is. So it takes a long time to begin to understand the anatomy. So if we look at the nasal tip, so this is the nasal tip right here. So if you think about it, these two sheets of paper are like the rhinoplasty, the tip itself, okay? Let's say the major reason people come for tip correction is that the tip looks too big. We use the words bulbous, bifid, round, whatever it may be, whatever ethnicity, there's a fullness that's there that people don't like. So in the old days, the way that I would remove that excess would be what's called a cephalic trim. So essentially what I would do is just tear off the top portion of it and make it thinner, okay? So I would do that on both sides. So then you would have two sides that look like this. So much thinner, more attractive. Now there are a lot of other maneuvers that I do, but the cephalic trim, I would take off the top portion. Now why don't I do this anymore? When I explain the lateral turn-in flap, it'll make more sense. So first of all, the nose is considerably weaker. When the nose is weaker, there's a higher chance that the nose could collapse inwards for breathing issues. Now, fortunately, when I've done this for so many years, I've never seen that because I'm so careful in terms of not over resecting this. But you can have a collapse inwards. And you can also have a weakening of the structure. And think about this. When the nose initially is bowed out like this is the shape of the cartilage. When it becomes weaker, what happens? It bows out even further like this. So yes, you get a thinning effect, but then it becomes even weaker. So the traditional cephalic trim, which is excising the top portion of the cartilage, does make the nose smaller and thinner, but at the expense of a weakening structure. So what do I do today? So let's go back to these two sheets of paper again. And if you visualize these two sheets of paper being slightly curved like this, I do what's called the lateral turn-in flap. So since I only have two hands, I'm gonna do one side at a time. So this bulkiness, which I used to take out on top, I would fold in. So watch this. So it's bowed in like this. You see how it's buckled and curved, making it more bulbous. When I fold it in like this, now the size is halved, just like what I showed you before. But what happens is, what's very interesting, is that curvature flattens. Because what I do is when I cut it, I don't cut all the way through. I just partially score the cartilage. And when I fold in a convex piece of cartilage onto itself, it actually buckles out to be flat. So that flattening is awesome because then this fullness is not there. And remember what I told you with the cephalic trim is after you've weakened the cartilage, you actually can potentially get even more bowing. By turning the flap in, now you get actually a more rigid support. So if you think of architectural support, I've actually created a much stronger girder, and it's also one that's less bulbous and also one that looks more attractive. So if we do both sides here with this lateral turn-in flap, essentially folding both in, you get that narrow result you get with a cephalic trim, but in this regard, you get a much stronger nose. And so you're actually being left with a stronger nose that's less bowed out and also finer. So I want to end this also with a concept that I probably need to do a separate video on, which is called a caudal septal extension graft. Essentially what that is, it's a graft that is anchored to the base of the septum. So this is the graft that in the old days I would just stick into the bottom of the nose and the nose would still float, and after a week or two the nose could change. I anchored this support to the bottom of the septum, which is the midline of the nose, so that it doesn't go anywhere. And then when I anchor the tip to it, now I have a very predictable tip outcome. I can position the tip where I want, and that's called a caudal septal extension graft. Now the reason I mention it in this video is not only can I position very accurately where that position goes, but also watch this. Now, I can only have two hands, so imagine that still being in the center. When I position this, okay, farther out, watch this. Let's say this still has a little bit of curvature to this, but I bring this farther out onto a fixed point. It's called a lateral tensioning maneuver. So essentially what happens is that nose goes forward, it creates a much stronger position. And now that is under tension and it's strong because it's on a firm anchor point. If this middle part was not on a firm anchor point, it was still free floating, you could never do that. It would actually just collapse inward. It's like a squeak hole. But now that it's firmly anchored, I can create lateral tensioning. Now, what does that do? Let's tilt the nose up this way, okay? Let's say this is the nostril, all right? If I can bring that even farther out this way, what does the nostril do? It narrows, all right? You can't do that without this combined effect of the caudal septal extension graft. Well, the lateral turn-in just adds a bonus. But having both of those together, I can create what's called a lateral tensioning maneuver, which is essentially narrowing the nose even before I do a nasal sill reduction or further reduction of the nose. That's why when I reduce the nostrils, I do that as a last maneuver, because after I've restructured the tip, it tells me how much narrowing that needs to be done at the end of the procedure. And that can also be done as an office procedure down the line. Now, I do a lot of other maneuvers to finesse the nose, like double dome binding sutures. I do tongue and groove techniques. There's a million techniques. I just wanted to focus on one of those techniques and one related technique in terms of understanding why today the lateral turn-in flap is my go-to method of not only refining the tip, but actually adding support and also creating a better structure than the old cephalic trim that I used to do.